To the member for Hasluck.
Thank you, Deputy Speaker. I want to compliment the member for Fremantle for putting forward this motion. It has always been my belief that our commitment in aid, particularly in the areas of health and in this particular field, are significant in the contribution that we make. I know that we often agree to the rights of individuals, we sign conventions, but the thing that needs to follow in all of this process is both the humanity and compassion that we need to consider in the way that we implement and put into place programs. I recently had a unique experience in Hasluck where I've established a disabilities and carers advisory group that comprises of carers and of people who are themselves experiencing difficulties. But let me say, without the health and allied health industries and agencies found in developed countries such as Australia, the plight of the disabled in developing countries is fairly dire. It is problematic because they don't have access to the level of skills and the type of supports that are needed. But let me just share with you some of the things that I have discovered in my journey which I think would be compounded significantly in countries that experience the third world conditions or who don't have access to the same things that we do. What was said to me is that we agree that children and young people are hit with disabilities, but they contend with the view that the hardest hit are the mothers, the carers who look after children. And I suspect that's compounded in third world countries or countries that we provide aid to. 75% of marriages disintegrate and men walk away from their responsibility of caring for children. Again, I think this problem would be compounded in countries that you have alluded to in your address. Post-school options for disabled children are dire in Australia, to non-existent in many parts. The young disabled men and women of Australia are sitting at home alone and isolated. Their parents don't know where to turn for help, and that was a very clear message that came out in a first world country. I would suspect that the problematic issue in any nation that we support would be much more dire than that, that the opportunities that an individual has to quality of life would be something that would be left to the way in which we perceive the problem. I also experienced some clear messages about accommodation options. Independent and supported accommodation options are few and far between. The consensus of having no accommodation options for carers, the consequences is elderly parents who look after their children until they themselves die. The other message I heard clearly from parents and caregivers is what happens to the person that I am caring for when I die? If we have this dilemma in this country, then it is again compounded in the countries that we provide aid to. That there is nobody, there is no system that provides that level of support and comfort. I think in our own backyard we are learning some of those very significant messages. Once they become adult, disabled children are often lumped in the 16 to 65 age group. Their individual needs are not addressed. Carers are isolated and lack support from agencies in the community, and respite care is expensive and difficult to arrange. With their lives as tough as they are, carers have the added burden of having to negotiate ridiculous red tape and bureaucracy. At least we're fortunate in this country to have that opportunity, although it is not favourable in terms of the challenges that families face. And I would hope that our aid is going to the process of implementation, not the broad-ranging, the establishment of a program, but the way in which it counts for any child or any adult who has a disability that is affected. Because the figures that the member from Fremantle mentioned are horrendous in the thinking that the aid that is often provided from a number of countries is not sufficient to meet need. Again, we have the same situation in our own country, so there is a compounding effect for anybody living in a country where you don't have access to the types of supports that prevail. I think the other thing that is challenging is that you can often be lost within systems. If people get lost within a system such as ours, then I suspect that these figures that you provide are only an indicative figure. They are not the true figure of children in countries that we provide aid to who experience disabilities. I commend the member for putting forward the private member's motion, and I support it. Thank you.